in a post-COVID future. We begin this series with the panel discussion on remembering Spanish flu during COVID-19, reinforcing existing inequalities or opening up new opportunities. We are very fortunate to have three panelists among us today: Professor Michaela Pelican, Professor Ulrike Lindner, and Dr. Jonathan Ngeh. Professor Pelican is a social anthropologist at the University of Cologne with seminal works on transnational migration, South-South mobility in sub-Saharan Africa, and inequality in the global South. Professor Lindner is a historian at the University of Cologne, engaging extensively with health migration, history of pandemics, and labor migration. Dr. Ngeh is a sociologist at the University of Cologne with research focus on immigration experiences of African migrants in different parts of the world, including the Gulf countries. And my name is Amrita Datta. I'm a sociologist at the University of Cologne with research interests in mobility and transnationalism with reference to Indian migrants in Germany. I'm going to moderate this session today. Welcome, Professor Pelican, Professor Lindner, and Dr. Ngeh. We are truly, truly delighted to have you among us today, and we really look forward to hearing you out during the panel discussion. Before we formally begin, I would quickly like to mention just a few things regarding how the panel is going to go. Firstly, the session is split into two halves: panel discussion of about 40 minutes, an open house of about 20 minutes. Now, this session is, as you can already understand, is going to be recorded till the house is open for discussion. So only the 40 minutes of the panel discussion will be recorded and not the open house. And in case you would like to refer back to the recordings later, they will be uploaded in the GSSC website. So you may please, in a couple of days time, we will be uploading them. So you may please go there and refer to them in case of later. So please do not record or take pictures of the session, of any portion of the session. And it is an open access web content that we will be uploading very soon too. Regarding interacting with the panelists, we would prefer that you hold your questions till the house is open, and you may please press the raise your hand button on Zoom and then ask your questions. In case of any technical difficulty for which you're not directly able to ask your question, then you may please write it in the chat box and we will take them up. Now, this is largely the basic details of how the panel is going to go. So now I would formally like to start the panel discussion. Any disease, especially a pandemic, has a social burden alongside a medical burden. We are more interested in the social burden, but we are also interested in the intersection of social and medical, or rather health burden of the pandemic in context here. For example, the Spanish flu on one hand and COVID-19 on the other. Now, Spanish flu has emerged as a typical reference point, as a benchmark of social protocol during COVID-19. Since COVID struck us almost a year back, the media and the governments across the world have been telling us to learn from the precedents of the Spanish flu to deal with the pandemic of the COVID-19. Although these two pandemics occurred more than a century apart, they are often compared. With this background, today's panel aims at addressing several questions that the two pandemics address and which ties the two pandemics together. For example, what kind of social manifestations do we witness during pandemics? For example, in terms of mobility, migration, inequality, exploitation, subjugation. Secondly, what must we anticipate as a post-COVID future? And thirdly, how must we negotiate with COVID-centric realities? So my first question goes to Professor Lindner. Professor Lindner, what are the reflections of the Spanish flu do you see on COVID-19, mainly in terms of preventive protocols, social behavior, public health initiatives? So how far is it justified to compare the Spanish flu with the coronavirus pandemic?
First of all, thank you, Amrita, for inviting me to this talk. It's really great to be part of it. I would like to answer. I think it's completely justified to compare the Spanish flu with Corona, because the Spanish flu was a new disease, as Corona is. No one had antibodies, and it was an airborne disease. And it had very similar transmission paths, and it was a global pandemic like COVID, and it hit the world in several waves that came for 1.5 or 2 years. And there are many similarities in the ways of transmission, and also in the ways it was tried to reduce. Yeah, there were preventive protocols. People wore masks in the US, in Australia, but not in Europe, for example. And what was also similar, that it hit the global south much more than the global north. Yeah, but because there were less preventive measures, and people were just were hit much more. But what is different, it happened in the last year of World War One. There was hardly any virology. And in Germany, for example, no one paid much attention. It was a lost war. There was a revolution, and there were no measures. So 2 million people died in the First World War. 200,000 died from the Spanish flu in Germany. And there were not so many measures, because the government thought people were in such a bad state, they couldn't just start trying to introduce these preventive protocols. And the same happened in France and in England. Switzerland made preventive protocols, the US and Australia did it. And on a global scale, if you ask how mobility was reduced, then I would say mobility was far less at that time. There was no air travel, but mobility was not reduced because troops were moved all the time. And it was how the Spanish flu came to Europe, was via American troops. It was not a Spanish disease. It emerged in the US, and it was called Spanish disease because there was a embargo on the press. I mean, there was and no one could publish anything, and only Spain was not in the war, so Spain reported about the flu. Yeah, and so it was called Spanish flu, but it emerged in the US and came with the troops to Europe, and came then with the mission of the troops. It came through the whole world. And in Germany, because the troops were demobilized, the disease came to the civilists and in the country. So it was very, very different, and the number of cases was much higher, but we don't know exactly. It's said it was 25 to 50 million deaths, and much more than caused by World War One, and that around 500 million were infected. But we don't know so much. Yeah, it was a very different time, and it was an interaction with World War One. So we have some similarities, but we also have a lot of differences.
Right. Some similarities and a lot of differences. We will be coming back to this very soon. Thank you, Professor Lindner, for your comments. I will now turn to Professor Pelican. Professor Pelican, as Professor Lindner pointed out, that mobility, during the Spanish flu was not really restricted. It did not reduce, because the troops, they went from US to European countries, and that's how the virus spread in the first place. So my question to you is migration a plausible outcome of a pandemic, or does it cause the pandemic?
Well, thank you, Amrita, for this question, which is quite a tricky question. I think what we have noticed, all of us, is that life has been stalled. Mobility has been reduced to a minimum, and that's for everybody. It concerns tourism, it concerns research travels, it concerns participation in conferences for us academics, but it also affects very much any form of professional mobility, labor migration, even study migration. I think so all of us who are participating in this panel and beyond have noticed the effects of the corona pandemic on our forms of lives and on our forms of mobility. So in that sense, it's different from what Professor Lindner has talked about in terms of mobility in previous phases. But what we can say is that those who have been particularly affected by this reduction of mobility or control of mobility are people in vulnerable situations, migrants, because all of us, we have been able, or most of us have been able to draw on other forms of communication and so on. But for migrants, being mobile is more than just communication. It also means an income and a life. And so many of them have been affected in very negative way, have experienced a loss of income and jobs, and many have fallen short of social security and safety networks. So as a result, many of them are not very happy with this, but it depends very much on the kind of situation they are in. For some, being in a different country and having access to the health and safety networks in that very country where they are living as migrants might even be better than back home. But for many, being in this new environment or in their country where they are working can also cause a lot of problems, particularly if they do not have access to health or safe social security networks. And so many of them would have liked to go back, particularly labor migrants, such as we have heard, for example, in the Gulf states or in many other countries where they cannot rely on any form of social networks. And so they would like to go back, but going back is another problem because A, the mobility has been reduced, and B, to have the means also to be mobile, because you need to have money, you need to have networks, you need to have possibilities. So at the same time, we have also seen that a different kind of trend in terms of, to the other question that you were asking, if mobility has actually fueled the spread of COVID-19. And there we have also seen reactions to that. What we have seen on quite a global scale is a rise of anti-immigrant sentiments, of nationalist sentiments, where people have been talking about immigrants and foreigners bringing this sickness to their country. We know them, we have heard them. I don't have to repeat it as the most common statements. And so this has caused other kind of irritations on very different levels. And it has become very particular and obvious in the earlier phase of the pandemic, so that the UN General Secretary Antonio Guterres even had to warn against the dangers of externalizing the fear of the pandemic by scapegoating foreigners and migrants. So he has called on all migrations to ensure respect for the rights of migrants and also of refugees, which has been another point I think has not been addressed enough in recent policies.
Right. Thank you, Professor Pelican. Externalizing the fear, against the migrants and the foreigners, as you rightly pointed out. In fact, there have been several cases of the African migrants becoming target of racial discrimination in China too. So this makes me wonder, and now I turn to Dr. Ngeh. Dr. Ngeh, what about the African migrants in the Arab region? What are their challenges in negotiating with the pandemic, and are those challenges temporary? Are they lasting? What's your opinion?
Well, first of all, I would like to thank you for the invitation to contribute to this very interesting discussion. I think it's a very relevant and timely topic. And on a general note, I mean, you find that there are overlaps between the experiences of migrants all over the world. So just as my colleague Michaela Pelican pointed out earlier, they have one of the difficulties is a loss of jobs, restricted mobility, and so forth. Yeah, and she also pointed to one important point that migrants, have the additional difficulties of not having access to healthcare and welfare support. In the context of the Gulf Arab state, this is very important because in those countries, there is no social protection whatsoever to support migrant workers, even when they lose their jobs. So returning to the home country or onward migration to new destination appears to be the only viable option. And in the spring of 2020, the main challenge to African migrants in the Gulf regions was going back to their home country. Yeah, and some African states, they organized flights to bring home nationals, and many migrants welcomed this and returned home. But organizing a flight was not enough for some migrants because they did not have money to purchase a return ticket. They expected their government to cover the cost. Yeah. This problem affected low-income migrants, I mean Africans migrants in particular, who live in the United Arab Emirates. So some other Gulf states, they approach the problem differently. Saudi Arabia, for example, organized several repatriation flights to the Horn of Africa, deporting thousands of Africans. So the Saudi initiative was criticized for deporting many of these migrants against their will. So, and you see this, the effect of this was so severe with migrants from Eritrea. Yeah, so Eritreans were afraid of returning to their country because of unrest, you know, and other political upheavals which are going on there. So, but after they were forcefully deported, you know, many of them migrated onward to Uganda and Sudan. And in those countries, of course, they face new challenges and lots of uncertainties and economic hardship. And in response to the second question, what we are noticing is a rapid shift to automation, which is affecting workers across the board, you know, by making them redundant or reducing the working day. So if this trend should continue, it is very likely that many of the jobs that are lost through this technological change are not going to come back. Yeah. So it means that most migrant workers affected by this are not going to get back their old jobs, even after the pandemic crisis has been resolved. Yeah. So one of the main challenges which is going to linger would be the job issue, you know, getting employment, getting jobs.
Right. Thank you, Dr. Ngeh. This is a really interesting that, you know, like different, while of course the massive challenge of COVID is looming large, but also it somewhere changes the entire landscape of migration at different levels. So taking this forward and, you know, keeping the post-war situation of the Spanish flu as a reference point, I have a question. My next question is for all three of our panelists. Do you see new scopes of mobility emerging? Or do you think that populist politics all across the world will use the pandemic in a post-pandemic situation as a leverage to bargain migration from global south to global north? Professor Pelican, how would you like to respond to that maybe?
Well, this is another question that addresses also migration policies and changing discourses in a European context, but also on a global scale. And obviously, this is going to happen. You know, there is going to be a different migration framework that's going to come about, because the pandemic basically has opened the possibility to introduce severe changes, I think. But I think we can also look at it in a different way, you know, in a more, let me say, non-political informed way, by thinking about how mobility is going to be re-evaluated from very different points of view and from very different stakeholders' points of view. So on the one hand, you have governments that probably can take advantage now and introduce, for example, much more restrictive migration policies, but also because they will have to, they will struggle with the effects of the economic impact of the COVID-19 pandemic. You know, they will have to recover economically, and they will have to consider on, you know, how to make way for their own population, you know, to recover from this economic shock as well as, you know, then consider how migrants will be able to contribute to this economic development. But then on the other hand, what I find also quite interesting is how mobility is or can or will probably be evaluated also from the perspective of ordinary people, you know, both from ordinary people based in their home countries and also those who are mobile. I mean, I think what is interesting is that before, you know, there was always this kind of discourse about immobility as being something negative. Everybody needs to be mobile. Being immobile means that you don't have the means to be mobile, or you don't have the right to be mobile. But I think there we have also seen a new a re-evaluation of this on the one hand in relation to valuing being stable, you know, being in a stable environment. I think that's one thing that many people have also started to revalue this. But and I can give also kind of example an anecdotal example from Cameroon, where I received a meme on WhatsApp, for example, where one farmer says to the other, oh, finally, I have a good chance to find a beautiful girl in my village because she's no longer interested in these migrants, you know, these people who go abroad to make money abroad because they bring back the sickness, and I'm here and I don't bring it, you know. So you see how it also kind of has an impact on how people see their own role within society and reposition themselves as, you know, those ones who are not mobile versus those ones who are mobile and are now positioned also not only in this kind of positive and affluent way in home societies of migrants. But it also, I think it has different, you know, it has very different kind of effects in terms of how mobility will be re-evaluated at this moment during the pandemic, but then also after, you know, in the post-pandemic phase. I think we will see a lot of changes, a lot of adaptations and new forms of feelings towards migration and mobility, but it's difficult to foresee because it very much depends also on the specific conditions in each country, among each population group and so on. So I think it will be very difficult to make general statements, but there will be new opportunities and also new closures.
Thank you, Professor Pelican. New opportunities and new closure. Professor Lindner, how do you respond to this?
If I might go back to the Spanish flu again, and
yes.
One would say that after the Spanish flu, mobility wasn't so much reduced, but mobility wasn't so high. And migration, for example, to the US was zero during the war, because during the war, migration was forbidden and no aliens were allowed in other countries. There was, of course, illegal migration, but not very much. And in the 20s, worldwide migration went back to the same scale it had before the pandemic. So that wasn't a big difference. But I think now the setup is very different, as Michaela already said, because first of all, the reducing of mobility wasn't such an option then, because there was no hope in a vaccine. The first vaccine was developed in the 1940s against a viral disease, and that was against the normal flu, in the end of the 40s. And the other big vaccine against viral diseases was polio in the 1960s. And so one had to endure it anyway. So there was no hope that if we stop mobility, then we could have a vaccine and go back to normal. So it was a very different setup. And the other thing is, we have as Michaela said, there might be new takes on mobility. Mobility is not maybe seen as a good in itself, as it was seen in the super mobile post-industrialist society of the North. And now we have the global warming as well, and it's also a silent catastrophe as a disease. And I think we have the threat of global warming that should be reduced by less CO2 emissions and less air travel. So that might be a new thinking in mobility also from this standpoint. And for us, I think I agree with Michaela that for migrants from the global south, it will be very complicated during the next years after the COVID pandemic, because many states will have to struggle with the economic impact of COVID. And they will try to protect their social systems and make migration less attractive, or will forbid migration. But I think there will be new options and other options, and it's really hard to tell. And I think we can't have a lesson from the Spanish flu because it was a completely different time.
Okay, thank you, Professor Lindner. Either way, mobility, migration from the global south definitely is going to face some backlash, as we get to hear so far. As Professor Lindner suggests and Professor Pelican suggests, so Dr. Ngeh, how would you like to add some reflections to that?
Okay, I mean, to start, I totally agree with them that migration will continue, no doubt, no matter what, because just take, for example, the imposition of travel restriction that affected everyone in all countries, has, made everyone to realize the importance of mobility, because everyone is complaining. Of course, some people have always had mobility, or have always had the means and possibilities to travel without any restrictions. So this is kind of new to them. But what is going to happen for sure is that the impact on mobility, especially mobility from the global south, will depend a lot on transformation in the economy, and also the economic situation itself with respect to job opportunities in migration destination countries. Because in the beginning, what is very clear now is that the pandemic has caused a lot of unemployment, and at the end of this, every country would be interested in employing their own nationals before looking at migrants. Yeah, but then the other problem would come about, in my opinion, because of the changes which I mentioned earlier, the shift to automation. And I think this is going to affect the demand for blue-collar migrants workers, not just in the Gulf state, but in all migration destination countries. And the implication of this, which I see, is that only migrants with certain skills would be welcome. Yeah, whereas restrictions on migration from weak economies, and especially in relation to people with limited skills, would increase very much. Yeah.
Right. Thank you, Dr. Ngeh. This definitely leads to an important scope in terms of taking a fresh look at global North, global South network, in terms of most likely say accessing the resources. For example, vaccine nationalism, one of the most crucial issues we are talking about these days globally. In that context, my next question goes out to all three of our panelists again. How do you locate the question of global inequality here? I mean, does that mean that the existing networks of systemic inequalities are paving the way for new contexts of inequality triggered by COVID-19? Or do we witness a reproduction of the old ties of inequality? Professor Lindner, how do you see this?
I think we have already seen that old ties of inequality are already reproduced in many countries, inside the countries, but also between countries, because many epidemics are no levelers, and people who have resources can deal with the disease and its impacts much easier than people without resources. And of course, it's also important if you live in a state that has a good health system, but otherwise, if you have a lot of money or you have a very stable situation, you own a lot of things, and you are not impacted as people who work in the informal economy, and just have to work every day just for their food and their clothing. And so for these people, it's absolutely horrible. And you have that normally with every epidemic, that it makes these differences even more blatant, and that you see that much more. And I think in the global north, COVID hits certain groups of professionals much more than other groups. So you have the tourism industry, you have the artists, musicians, people from the cultural sector. And I think, but in the global south, it also hits people who work in the emerging and the big tourism industry, which is in some countries of the global south the only, or one of the only income options. And it's always most dangerous for people who work in the informal economy and who are not entitled to any benefits. But what I think what was quite hopeful, that there was some solidarity between groups during lockdowns in the global south and north, and that not only othering and scapegoating, but also some solidarity, and that might maybe bring some new good developments, hopefully so.
Thank you. Thank you, Professor Lindner. So old ties stay, but new networks of solidarity, new networks of community and collective assertion emerging too. Professor Pelican, do you see new networks emerging as well? What is your take on this?
Yeah, thank you for this question because it allows me also to introduce a research project and a network that all three of us are part of, Professor Lindner, Dr. Ngeh, and myself also. And that's a Volkswagen supported project on the production, reproduction of social inequalities through concepts and contexts and concepts of labor exploitation. And in this research network, we have two more partners. One is Meron Ereso in Ethiopia, who is based at the University of Addis Ababa in Ethiopia, and Professor Tu Huin, who is based at Jinan University in Guangzhou in China. So when the COVID-19 pandemic evolved, basically we were used to have discussions among ourselves on a regular basis, where we also addressed this topic of how COVID-19 has been affecting each of our lives as part of this network, and how it has affected also social inequality in the specific context where we live and also where we do research. And one of the things which was very interesting is that particularly our colleagues Meron Ereso and Tu Huin also brought to our attention developments in terms of solidarity. So for example, Meron Ereso, she was telling us that at the university where she was teaching, university professors were making an effort to support students, to use their money and their time to photocopy things, to send it to their students, because not all the students had access to internet, for online teaching, for example. So they sacrificed their time and money to support their students. And also, the return flights of repatriation flights of migrants based in Saudi Arabia, that as well was raising a lot of attention in the Ethiopian context, where the population was solidarizing with these migrants who were forcefully returned. Similarly, Tu Huin was also telling us about the situation of African migrants in China, who were facing serious discrimination and also problems of finding homes and support in their places where they were staying, mostly in Guangzhou, and where there were solidarity networks among the local population, other African migrants or migrants from America and other places who were coming together. Also Chinese people were coming together to support these African migrants who were displaced, who had to leave their houses and live on the streets, and they were given food parcels, clothing, and so on. So you see this kind of developments in different places. And I think it is important that we do not only look at these kind of negative effects of the the COVID pandemic in terms of like reinforcing existing inequalities, which obviously is happening, but also at the emergence of new solidarity networks. And this is a point that we want to develop another project, or we have to develop another project which we want to execute on the effects of COVID-19 on migrants, African migrants in China, and also in the Gulf states, where we focus specifically also on these kind of positive effects. And what I want to add here is also I was taking part in a meeting organized by the European Union Research Council, and that meeting had one section on global inequality and how because it is one of the UN goals to reduce global inequality. And so we were discussing on what kind of research is needed basically to incorporate that kind of goal and also to contribute to it. And so in this discussion, that point also came up that we should look for utopian views. We should look for positive examples. And these positive examples of utopian views do not necessarily come from the global north. Many of them obviously come also from the global south. And so we should take this serious and try to find positive ways of how to deal with COVID-19 and also the post-COVID situation. And here I would like to refer also to a theoretical concept that has been introduced by Nina Glick-Schiller and Aisha Chawla in their recent book Migrants and City Making, where they talk about urban sociabilities. And I'm sure Nina Glick-Schiller will also talk about this in the next session of this talks here when she's going to present another time. So I think it's something we definitely need to keep in mind.
Thank you. Thank you so much. New networks of solidarity from the global south, which we definitely need to keep in mind too. Dr. Ngeh, are we likely to witness such networks and solidarity in context of basic health infrastructures as well?
Okay, I think first of all, I would like to point out that networks and solidarity, these are very vital tools when dealing with a global pandemic. Yeah. And we've seen this in the past. The eradication of polio and smallpox in the last century was largely possible through a concerted global effort involving scientists, philanthropists, and different other actors. The fight against HIV, AIDS, and Ebola played out in a similar way, relying on coordinated global actions. So with respect to the COVID-19 pandemic, the crisis has stirred up both generous humanity and ugly insularity. Yeah. So acts of humanity, for example, include those of Cuban medics assisting COVID-19 patients in countries in the global south and north. Yeah. While distrust of global health initiatives that are rooted in colonial histories has increased in Africa since the start of the pandemic. But today there is wide support for local initiative and collaboration with African health institutions. And the most important example here, and I think one can see this also as a solidarity or support for local initiatives, even though it's happening at the time when there is some kind of skepticism towards initiatives that are coming from outside. So we have um, the World Health Organization, the Africa Center for Disease Control and Prevention, and the African Union Commission for Social Affairs, have worked together to support research and development effort on traditional medicine against the pandemic. And this came about, against this background of of a wide support for local initiatives, in Africa. Yeah. So a master protocol was established last September for COVID-19 herbal medicine clinical trials. So the goal is to empower and develop a critical mass of technical capacity of scientists in Africa to conduct proper clinical trials to ensure quality, safety, and efficacy of traditional medicine in line with international standard. So this is one of those positive outcome which is coming, and is being is possible because of this network of local actors which are really rooting for local solutions. And on a broader level, they are also working with the international health organization like the World Health Organization. Yeah. So my response here basically is that solidarity and network, we are experiencing them in the global south, but we are experiencing them in ways that are not really maybe what we expect or what we've seen in the past.
Right. Thank you, Dr. Ngeh. Uh, Different networks, especially emerging in the global south, which have positive, which we hope to have had positive outcomes in terms of negotiating with the virus and dealing with and coping with the post-pandemic situation. A very interesting context in here is also about the anti-mask and anti-lockdown protests in the global north, which we have not really seen in the global south so far. And these kind of protests, they show a lot of distrust in the whole health infrastructure of the country. But it also makes me wonder that the entire experience of negotiating with and like dealing with the contagion in the global north is so different from that of the global south. Because if we take countries like Bangladesh, Pakistan, India, and then maybe some African countries, as we're talking about, with limited healthcare system, what does one choose when the choice is between right to live and right to freedom of expression? So this is another very tricky situation and a very different scenario in the global south in terms of experiencing the contagion and negotiating the contagion. So this brings us to the end of this very insightful panel discussion. We already have taken 40 minutes, so I will take 5 more minutes very quickly to just share with you the takeaways from this session so far. So firstly, new premise that emerges during COVID-19, which was missing from the Spanish flu, is vaccine. There was no vaccine in the horizon for people, but now we are all looking forward to, we are all asking this question, when will the vaccine arrive? But this also does open up a new context of inequality between global north and global south, even within among the global north countries in terms of accessing the vaccine, like people's citizens' right to universal immunization, and which age group should get the vaccine first, which profession of people should get the vaccine first, like should the frontline workers get the vaccine first, should the elderly people get the vaccine first, and also who can afford it faster. So this is definitely a big circumstantial difference between the Spanish flu and the COVID-19 that we discussed so far, and it does open up new contexts of inequalities. Another big difference is technological advancement, be it social media, information overdose, or tracking the movements of the citizens through chips on their shoulders, which have increased beyond recognition in 100 years. So high level of technology has now enabled the governments to watch, track, and control their citizens within the framework of what Foucault termed as surveillance society. And such practices are easily extended into monitoring who is following COVID protocols and who are not following COVID protocols. But the question is, for example, the government in Singapore is putting their citizens under 24/7 surveillance to document their COVID-centric activities and just punishing them who are faltering, which has its own merits, but it also opens up a question like, is this a violation of human rights? So such practices could easily validate as mechanisms for subjugating human and citizenship rights in the name of protection from coronavirus, a situation which was almost non-existent during the Spanish flu. So in that light, another new context of inequality is about rights of the people versus state responsibility to look after its people. For example, in Berlin, the movement against compulsory face mask has invoked both criticism and participations. A third possibility, which all our panelists discussed, is COVID-19 could change the migration landscape if migrants are only with some skill sets are welcome, whereas a lot of other profile of migrants are left out. So new links and new features of mobility are definitely going to emerge, which may, however, deepen the inequality in global south. As for example, if only high-skilled migrants are accepted in the global north, whereas blue-collar migrants, agricultural migrants, they struggle to find their place in the whole society, then this is definitely going to reflect on the economic structure in the global south countries in terms of food production, food security, and remittances. So a possibility of such a situation throws light on the overall challenges that migrants are going to face right after a pandemic, in the post-pandemic, in the post-COVID-19 scenario. It is likely, as our panelists pointed out, that the blue-collar workers are going to face border control issues, while entering the global north countries. But to add, there is a double disadvantage for those low-skilled migrants who have already migrated from countries with political tensions. For example, from African countries or even possibly from India. And now they are, due to the pandemic, they're forced to go back home. But for them, going back home does not threaten their lives. It does not threaten their jobs. It threatens their lives too. So it's a life risk situation when they're forced to go back home. So in that light, I will pose two questions for us to reflect and maybe take up during the open house before I stop. Firstly, what happens when home is a dangerous place, but migrants are forced to return there during a pandemic nevertheless? And secondly, is migration symptomatic of the inherent inequalities only to be pronounced by a pandemic? So with these two questions, we now open the house for further discussion. And thank you so much, our panelists, for your reflections. We will be talking more during the open house.